Candid, your go.
Okay, I'm starting with the streaming first and hitting record now.
Thank you, ma'am.
Okay, so this is Dave Velasquez, I think you all know, and I want to welcome you to our Prince George's Forward Task Force meeting. This is a meeting of the full task force. Again, thank everyone for participating and dialing in, and the very important work that we're undertaking. Dr. Dukes hopefully will be able to join us a little bit later. Her apologies for not being able to be on right at the beginning of the call. But her and I have the privilege of co-chairing this task force. And the purpose of today's meeting, there are 3 or 4 items we wanted to cover on today's meeting, starting with a review of the approved short-term recommendations, then an update on the public communication, an update as well on the implementation of the quick wins that this task force had brought forward and had been approved earlier. And then some more information from Dr. Wright on the need for champions to help drive the vaccination rates to make sure we get the greatest number of people vaccinated as well. So that's our agenda for today. Again, I just want to start by thanking all the task force members. I know this has been a number of months where you have really put in a lot of time, a lot of effort, and a lot of creativity. And thank you for that. And I think that's reflected in both the recommendations that have already been improved and started to be implemented, the quick wins. Also the approvals as we're going forward. I'm going to talk about today the visions for tomorrow. And I know that the task force is also working on their longer term recommendations as well. So looking forward as we continue to work this year to being able to complete our work in the first quarter as well. Before I turn it over to the subcommittee chairs to provide their reports on their approved short-term recommendations, just wanted to turn to David Sloan to see if there are any, or Linda or anyone, if there are any sort of logistical or other issues we need to cover before we dive in.
Can you hear me, David?
Yes.
So just for everyone's background on the presentations today, everything should be in this one PowerPoint. We should be able to move through the entire agenda, all right, with this file. If there are any issues at any point in time, Linda or I will pull up backup files, okay?
Okay, great. Well, how about if we get started then? And we're going to start today with Mr. Graham, who chairs the Economic Recovery Subcommittee, and I'll turn it over to him. Mr. Graham.
David, Mr. Velasquez, before we
Yes.
start, I'm sorry, this is Glenda. We're going to, as far as the chat, we're going to do the chat a little bit different this time. Okay. And if anybody has any questions, Miriam Brewer is going to just put in the chat box question. And and then Miriam is going to call on you if the task force member will unmute themselves and ask the question, and then mute themselves back after they ask the question. Dr. Dukes wanted to do it a little different today. She just hasn't gotten on to talk about it yet.
Okay, great. And I think we were going to hold the questions till all the subcommittees have given their presentations, because often
yes,
there's recommendations that kind of, I'll say, flow through from one to another. So I want to make sure you hear everything before you have your question.
Yes, and when they put their question in the question, if they would in the chat box, if they would just say question and then which subject matter, whether it's education, economic development, recovery, and that way we'll know which subcommittee chair, who the question is directed to.
Yeah, great.
Thank you very much.
Okay. Tom?
All right. Okay, thank you, Mr. Velasquez, and I want to thank the county executive for the opportunity to serve in this capacity for the county. Also, many thanks to my committed team for all the hours of work that they put in through this phase of this particular project. Next slide, please. And then I think it's also appropriate to recognize DCO Angie Rogers for her leadership, and also the members of the economic cluster, and then finally Brandon Starks, who supports our group directly. So as a reminder to everyone, we had 7 specific focus areas: jobs recovery, business recovery, tourism recovery, economic relief, real estate recovery, policy tools and resources, and finally mass transit guidance. Next slide, please. Let me move this little box away. So we'll start with the first of our 5 short-term recommendations. This one was approved. We thank you for that. This is to improve the regulatory process to attract economic development opportunities in Prince George's County. So what does that mean? What we're trying to do here is improve the timeframes and some of the systemic complexities that many feel that are within our current system. We also want to re-examine the development fee structure to see if that is really competitive with our neighboring jurisdictions. We've done some preliminary research on that. We have the advantage of perhaps land being a little bit cheaper, but our concern is with the development fee structure we have, it evens the playing field as we go along. So we want to take a look at that. We also want to increase flexibility to quickly fill critical vacant positions in permitting and inspections. That's a flexibility that the director does not have right now. Our recommendation is to provide her that opportunity. And then finally, creating an ombudsman position outside of DPI that will work directly with customers to resolve issues and challenges. So we thought this was important to provide that resource that our customers could seek guidance from, and in turn speed up that whole process. So the implementation of this recommendation, we feel, will attract new economic development opportunities to further grow the county's tax base and create new employment opportunities. Can we go to the next slide, please? So our next recommendation is under further review. So we had 5 altogether, and I believe 3 were approved. So this is still under review. It's to achieve 50% public procurement with small, minority, and county-based businesses. Currently, we're probably at about 30%, and I believe there was legislation, and I believe it was CB 74 2016, which established a threshold about 40%. We had proposed 50% here. We thought the vendor participation through enhanced engagement with local business and organizations and county initiatives. We just lost the slide. Can we get the deck back up, please? Okay, very good. So this is kind of complementary to the Green Book, which was part of our quick win recommendations that was approved. The whole idea is to be more supportive of local businesses within Prince George's County. That Green Book process, I believe, started off with about 11 agencies with the goal to move to about 40 agencies, and this kind of builds off of that. We want to be able to provide capacity building support and resources to increase procurement opportunities. And ultimately, the idea here was implementation of this recommendation would increase revenue for county-based businesses and generate new jobs for county residents. So I think the key piece here is, in order for something like this to be effective in the future and something to be considered, since this is still under review, we have to have the ability to increase capacity. That's key. And then we want to support small businesses. We want to support minority businesses, but it defeats the purpose if we're not intentionally staying within Prince George's County to support those businesses. Next slide, please. This third recommendation is also under review. It addresses tourism communications and marketing strategy. The idea is to utilize the county's major attractions and current infrastructure to develop a unified marketing and communications plan. We believe the implementation of this recommendation will develop brand identity to expand development in the tourism section. So I think there's some great resources in Prince George's County. We just need to do a little bit better job of promoting those, whether that be National Harbor or through the Parks and Recreation. We have very extensive park to recreations here in Prince George's County, whether that be Six Flags, whether that be the Washington football team, whatever that might be. But there are tourist attractions here that we need to develop a very defined and thoughtful marketing strategy behind. Next slide, please. So this one was approved. It's our fourth one. It's economic development communications marketing strategy. We wanted to develop a targeted strategic campaign to attract specific business sectors. Good example, recent example of this are data centers to Prince George's County. We believe the implementation of this recommendation will develop brand awareness around the county's strength in alignment with its capacity to expand development in the sectors identified. Earlier on in the process, we received a presentation from a consultant that's helping the county, helping the Economic Development Corporation, really define, what that's going to look like. So I'm happy to see here that this recommendation was approved. Next slide, please. And then our final recommendation that was also approved has to do with DPI, the Department of Permitting, Inspections, and Enforcement. And the idea here is to create a customer satisfaction survey. What we want to do is survey past and present customers and really gauge their experience navigating the permitting and inspection process. I think in this manner, we can establish a baseline, and the agency can have a better understanding of what the experiences are of those developers or businesses that interact with DPI on a regular basis. And in this way, it can drive better customer satisfaction, and it also be helpful to attract more businesses to Prince George's County. So what we'll also provide through this is the insight and the analysis, and through all of that, we can have a better product, a stronger product, a more effective organization. So the outcomes will be used to establish a baseline for future performance. And I think customer satisfaction is something that's very important. I think DPI is a service organization, and this is the reason why that we pushed this recommendation forward. And again, we're glad to see it was approved. So with that, Mr. Velasquez, that concludes the report from the Economic Recovery Subgroup. Thank you.
Graham, thanks. Thanks for that report. And again, thanks for all the work that you and your subcommittee is doing to help drive forward Prince George's County and the economic development, which is so vital to that as well. Next, we're going to have a report from the Government Operations Recovery Task Force. Regrettably, former Governor O'Malley is not able to be here, but the group is more than ably represented by Mr. Jared McCarthy, who's a deputy CAO. And I think it's probably Jared's first meeting, so I wanted to make sure I welcome him and thank him for his work and efforts. And I'll turn it over, Mr. McCarthy, to you to speak about the Government Operations Work Group recommendations.
Sure, and thank you very much, Mr. Chair, and good afternoon, everybody. It's a pleasure to be on the task force. Some of you know me, some of you don't, so I'm just going to take a brief moment to introduce myself. As referenced, my name is Jared McCarthy. Under the Baker administration, I was the last of Mr. Baker's county attorneys, and hopefully the best, as I like to tell my former boss, the county attorney, Miss Green. But no, in all reality, I've been a judge for the past 2 years. Unfortunately for me, lost an election, but much more fortunately for me, Miss Also Brooks invited me back to join her administration once again. I was the county attorney for about the first month and a half in her administration. So with that, we're going to walk through Governor O'Malley's recommendations. If we could have the next slide. So Government O'Malley was primarily focused on the operational side of county government and specifically looking at 4 real factors here. And they're outlined, and I'm not going to read them directly to you, but he looked at performance, the customer facing services that, the really where the community interacts the most with county government, our internal and external risks, primarily on the cyber side, as well as some health and human service type training for our managers. And then one of the bigger issues for all counties at the moment, which is continuity of government, and certainly something that we're all looking at through continuation of operation plans and things of that nature. Next slide. So all of Governor O'Malley's recommendations and the task force as a whole, and I do want to thank Deborah Patrick, and I'll be honest, without her support here, I would not have come up to speed as quickly as I have. So I do want to thank Ms. Patrick for providing me with the briefings and bringing me up to speed on the hard work that Governor O'Malley and now CAO Jackson had done as part of this team. So all 6 of their recommendations are approved. And the first one is the continuity of government plans. And really where we stand is we had given a deadline to all county agencies of December 31st to update their continuity of government plans. Most of them have. We have a couple of stragglers that I need to poke along to get those plans in place. Specifically, they were asked to update with a mindset that they may lose up to 40% of their staffing due to the pandemic, and how would they operate with that kind of staffing loss. So we're now in the process working with the Office of Emergency Management. We're going through those plans. We're going to collate them and get back to the point of where we're going to pick a couple of to run through the testing and make sure with the actual departments that we understand the plans and that the plans in fact could be implemented as submitted. We expect to get through that process by early February. Next slide, sorry. Thank you very much. So this is our second approved recommendation, which is to revise the individual employee performance appraisals. One of the things that I think all government people know is employee performance appraisals can either be a check the box type attitude where you simply go down and you check, and everyone magically comes up with exceeds expectations or whatever your measurement metric is, and you have 1 or 2 people that have to go through the whole process. What we find then is that these plans really aren't that valuable or useful to employees. They don't provide definable goals, definable measures, doesn't give employees something to strive for. So we are in the process of updating those. The Office of Human Resource Management has done some of the initial legwork, and we expect to roll these out probably in the next 6 months, quite frankly. I know we wanted these to be a little quicker than that, but I will be honest that with everything we're doing with COVID, I think that has slowed us down a little bit, but we are still working to get these up and running in the next fiscal year. Next slide. So cybersecurity enhancements, this was a big issue. One of the things we had found from an operational perspective is we had all these little buckets of information out there in the cloud. We had a number of contracts that were used to procure services, and they weren't really being focused behind sort of our Office of Information Technology's firewall. So we had information that we either knew or didn't know was out there in the cloud, and we're working on a multi-faceted front here, one with OCS. So when they see contracts that include either an informational component or a cloud component, that we hit the brakes, that we bring OCS in. We're also doing much more in the way of training. I myself am scheduled for training that I have to complete by the end of this month. And we're also looking I know we have the mental health here. I think that'll go in a different slide, but we're also looking from an IT perspective to utilize sort of our mass purchasing to bring in some more, let's just say, some more centralization here and get rid of the decentralization that I think has led to some of the the cybersecurity issues here. Next, I know that there was a question. If there is one, I'm happy to take it, but I'll take it towards the end. Next slide, please. So this is the next one, the customer facing. And this was, I think, coincides with what Mr. Graham was talking about with DPI as well, and overlaps with his customer satisfaction survey. So what we are doing is really getting an inventory of all of our customer facing services. And, there's some big ones like DPI that are readily available, but there's also many that we don't have. And from a cyber perspective, there's many that we don't have that are really accessible from a cyber or a telework kind of mentality, as opposed to, you have to come to an information counter, which at the moment really is not an option for most people. So we're trying to come up with that roadmap where we have all of our customer facing assets identified, what they do identified, the services identified, and then go from there to figure out how we can better utilize either, again, infrastructure through cyber, telework, all of those things to make it a better experience for the customer. And certainly a part of that will be the satisfaction surveys, which will most likely roll out to more agencies than just DPI. Next, approved. So the mental health training, which I think we had a slide in under cyber as well. This is one of those where we had a focus and a recommendation that we look at. A lot of employees are certainly in the pandemic experiencing much more issues with mental health. And it's certainly in many communities and many families, there's a stigma around this. So there's not a lot of what I would say is broad-based knowledge. This is not something as well known as your regular dental appointments or your regular physical checkups. So what we're wanting to do is roll out specific training to our managers for how they can identify, how they can appropriately address, and how they can deal with issues of mental health in the workplace. And certainly there's a lot of intersection here with regulatory compliance, things such as Title VII, the ADA, ADEA, all of those laws that give, sort of what I call guardrails for which managers have to be in. One of the things we're struggling with on this is the initial proposed training was 6 hours. And I think one of the things we've realized, especially in today's time crunch with the pandemic, is we have to figure out how we're going to whittle that back to a much more usable training for our directors. Asking our directors at the moment to set aside 6 hours of their time, quite frankly, is just not practicable. We have to find, working with our provider, who I think was Cigna, we have to work on something that may be a little more focused for them to make sure we can have an effective training, but also one that respects the facts that our directors are being pulled in many different directions at this point. So we are now working to rework that training. It was originally scheduled to be done in early February. We think we're going to push it back a month or two and make sure that we have something that's better suited to our workforce. Next slide, please. So the last one is really the dashboard management and performance management. We're looking to find a way to really effectively do this. And we've had some discussions internally with county stat as to how we're going to kick this off, specific dashboards, and really the top 10, which what we call CSRs, the county, whether you call them county service requests or customer service requests. We're looking at those to be the kickoff and really focus on, okay, these are the top 10 that we get through 311. These are the top 10 that are obviously of importance to the community. And how do we then create a dashboard that really effectively works for the department, as well as the effective follow-up from management? So we're working on that, and we just had one of our kickoff meetings with the CAO on that, and our next meeting is about 2 weeks out, and we expect, again, to have this at least kicked off by the start of the next fiscal year. Next slide, and I think that concludes my presentation. Thank you very much.
Yes, Mr. McCarthy, thanks for that. And the question that came up was a very simple, straightforward one, so maybe we'll just let you answer it now, which was our annual tabletop drills part of the continuity plan?
So what we're anticipating with that is actually speaking with Ronnie Gill, once we get out of really the headache of the vaccine rollout and we get that a little more under our belt, what we want to go to are quarterly drills, because we don't want to try to overload the Office of Emergency Management. So on a quarterly basis, we would pick a quarter of the plans to go through and just keep that on a rolling basis. And it may be something that's a little more stringent of a test. We'll pick a couple, and for some, it may just be more of a review of their plan. So there is definitely a concept there of at least on a quarterly basis throughout the calendar or fiscal year, we will touch a quarter of the plans. So that hopefully as we roll through on an annual basis, we've touched all the plans, maybe not a full-blown drill, but certainly touched all of them.
Okay, thanks. Thanks for that answer. Now I wanted to turn to the Education Recovery Work Group, and I'll turn it over to Dr. Pines.
Thank you, Mr. Co-Chair Velasquez, and thank you, Dr. Dukes, also our co-chair. And I want to thank also the county executive for giving me the opportunity to lead this education subcommittee and recovery subcommittee for all of Prince George's County. As you all know, it's been very difficult for K-12 education and also for higher education, but much more difficult for K-12 education. And our committee members have worked extremely hard, as many other committee members, to really think about things that are very important to help move the current system forward and, of course, in the future, strategically forward. So I want to thank my colleagues of the committee, Dr. Askew, Ms. Madison Gray, for her support in helping us really work together to help advance the county's educational system. Next chart, please. So we had 5 special focus areas for our Education Recovery Subcommittee. As you can see here, resetting the pre-K academic plan and delivery models. Number 2, expansion of online learning and technology supports. Of course, online learning and broadband and devices were extremely important to help deliver virtual learning. Number 3, rethinking opportunities and delivery models in post-secondary education. Number 4, resource allocation. And number 5, closing the digital divide and optimizing secure technology. Next chart, please. So we had a number of short-term recommendations that have been approved and some that are under further review. So one of our ones that is under further review is the reimagination of the use of resources and personnel. What this implies is that some of our teachers are very good at teaching in the virtual learning environment. Others are very good at the in-person environment, and others are good at mentorship. So the thought is that one could look at personnel resources and reimagine how to reallocate them as a result of this pandemic that we all have been living in, and really better use our personnel and our resources and our facilities to deliver virtual learning to our students. We believe this is at really minimal cost to the school system in terms of optimizing how this could be done. And to further enhance this effort, we would properly map educational assets, expand summer youth enrichment programs, and align county digital resources as well. So that was one that's still under further review. Number 2, expand parent support center program. So this is more of a concept that's been approved, extending the community school concept that already exists to promote a holistic approach to supporting the entire community, the parents, the infrastructure for supporting those students, teacher support, teaching assistants, tutorial services, communication, all really to help the family and to help the community move forward in education. So that's been approved. Number 3, this is interesting because of the pandemic. And so most higher education institutions, both community colleges and four-year institutions, because of the inability of students to get access to the testing sites for standardized tests, such as the SAT and others, most of the testing services have decided that they can't deliver the test digitally. They did most of their things in person. And therefore, most of the universities have gone this year and maybe even next year to test optional. That is, some folks who can take the test can submit their SAT scores for the admission process. Others who are not able to do it or decide not to do it, it's test optional. So there's a new strategy that's emerging where our students in our county can literally get admitted to many institutions strategically because of this option of not having to take a standardized test. And we need to think that through and how to launch major communication and marketing campaign to our students for this fall, for the November 1st deadlines of 2021 across Bowie State University, Prince George's Community College, and of course, the University of Maryland College Park. It's an exciting opportunity because I actually believe that more of our students will get admitted both locally and also regionally because of this test optional phenomenon that's happening. Next chart. Another one that we came up with is Youth Matter. And so it's important to positively recognize our youth and celebrate their accomplishments and celebrate them at the highest level. That is where the county executive may offer a number of different types of awards that are based on commitment to service, commitment to academic scholarship, commitment to social endeavors. And so to promote our youth and really build up this sort of group of leadership and exciting opportunities for our youth by actually promoting them. So promote and celebrate notable youth accomplishment and young adult enrichment programs offered through Prince George's County, provide tangible rewards and recognition for participants who excel and share their stories throughout our entire community to build pride, community pride, and expectations for our young people. So that's been approved. And then the last one is the online teacher assistance. We want to, basically, we discovered that it's really a service that can be offered to many students in Prince George's County throughout the entire K-12 enterprise, where teaching assistants can be helpful to teachers to provide additional instructional learning experiences for our students to help them advance in various subject matters. And this all can be done virtually and remote. Similarly with tutors to provide additional after school hours to help our students advance. And this is just a strategy that we've already seen work last fall semester, and we know that if we've done it more strategically, we can advance more of our students' ability to learn better in all of their subjects and be successful. Next chart, please. And that was it. That was my last chart. So thank you so much, and look forward to any questions.
Dr. Pines, thank you. And again, as we get questions, we're probably going to hold most of them to the end to make sure that we're collecting all of them. But again, appreciate the work your group is doing, and we all recognize how important education is, both in the short term, but also in the longer term for the vibrancy of our community. Next, I wanted to turn to the Human Services and Social Services Recovery Work Group, which is chaired by Ms. Allen Herring. And I'll turn it over to Ms. Allen Herring to provide a report on the recommendations there.
Thank you so much, and good afternoon. Thank you, Mr. Chair, and to Madam Chair as well, who I see is on. It is indeed a pleasure to be with you this afternoon and to share, along with my colleagues from all of the subcommittees, the great work that continues to be done in this light. We can go to the next slide. I do want to acknowledge our partners in this work, our Deputy CO, Dr. George Askew, as well as Madison Gray, our liaison, and the plethora of county professionals that work with us on this effort. As you can see, we have really 4 special focus areas, with 3 of them sort of kind of active, with the equity lens being basically broad-based across each of the special focus areas. The first one, of course, with integrating data, is led by Judge Sheila Tillerson Adams, as well as our Strengthening Public-Private Partnerships is run by Diana Leon Taylor from the County Executive's Office, and Identifying Individual and Family Needs in Real Time is chaired by Erin Bradley from AOBA. We can go to the next slide. You can see from our slides, and we have just 3 more, there are 11 recommendations from the Human and Social Services Recovery Subcommittee. While 6 of them are approved, 5 of them are continuing to be under review. Some of them are new with additional information that has been shared. Under reinforcing efforts to provide safe housing and survivors of domestic violence, again, one of the things that's continued to come up that's a part of this evolution of the crisis is not only the domestic violence effort, but also human trafficking, child abuse, and other mental health issues. So we simply are making certain that we bring those to the forefront. This one is approved, somewhat new as it continues to evolve around all of the various groupings, if you will, that we can ensure we bring support to. We are working, of course, with the Department of Family Services, and as I shared earlier, we have representation from across the county and all of their social services organizations that are a part of this work as well. The second one is approved food distribution coordinating enhancement. Again, as we talked about, having a czar, if you will, because food insecurity continues to be one of the biggest challenges for many of the families that have been impacted by the epidemic. And so when we look at it, we're looking at it from not only being able to provide those services on a day-to-day basis, but we're also looking at it from what does the data tell us that the needs will be going forward as well as far into the future. So we're looking at what we call GIS or heat mapping, geospatial mapping to know where those services are being provided from across the county to ensure that there is a leverage opportunity and consistency in what we offer. So one part of the county should not necessarily be flush with resources and another part of the county not having as much available to them. So we're looking at it from a leverage opportunity of looking across the entire county for that data. The third one is improving the county COVID-19 webpage. And again, this is something that is ongoing as resources become more available, information becomes more available. We want to ensure the website for the county is not only user-friendly, but that it is useful and effective in being able to get out information. Testing is still very much a big part of what we want to see done, and you'll hear more, of course, in our partnership with the health recovery by Dr. Wright. But we also want to make certain that there's information around not only the testing, but as vaccinations become more and more available across the county, we want to use this website to be able to show where that information is so that many of the residents, when it's their turn, the opportunity presents itself, they'll know where to go to be able to access those services. We can go to the next page. One of the things that is under further review that we discovered as a part of this work is the Beyond Foster Care effort. We came to understand that there were many young people who are at the age of leaving foster care, but of course in the middle of the pandemic would have had a very tough time being able to assimilate into society and be able to access the resources that help them to ensure that they're successful when they leave foster care. So that has been an area of focus for us that we've continued to put focus on in terms of bringing resources to bear. The county has been very good in sharing that data with us. We know that there had been a moratorium from those releases to ensure that they remained with the county for now. And until we get additional information, we will assume that that moratorium will remain in place. The faith-based and nonprofit communication and coordination, again, this is a significant effort for us. The county is known for having significant faith-based partnerships. And because of that, we want to ensure that we're able to leverage the ability of each of those entities to bring not only what they intend and perhaps usually do, but certainly being able to expand upon that and coordinate that, similar to the food distribution effort as well. The grant funding was an issue that came up again as we continue to evolve, and we looked at all of the various populations that have been impacted. While certainly no segment of society has not been impacted by this, we know that some have been more so than others. When we look at the education of our children in terms of distance learning, we know that that's a segment of our population that's been disproportionately impacted. Certainly, we recognize that many of our seniors have been disproportionately impacted. They tend to be more isolated than others. They tend to not go out. They have underlying conditions and such. And so we want to ensure that as a part of the mental health effort even, that we're able to deal with the isolationism and ensure that our seniors have typically what they need as well. We can go to the next slide. The creation of the Eviction PSA to notify and educate residents of the resources that are available to them, that continues to be a challenge. If you notice, even today, the new president of the United States signed as one of his executive orders the eviction protections that has been put out, as well as student loan protections as well. We will continue to work with the governor's office to ensure that that trickles down to not only us in the state level, but certainly on the county as well. We continue to try to bring forth those resources so that many of our residents who may find themselves experiencing a challenge when it comes to eviction and or rent assistance, that they are able to access those resources. Looking for local funding and ongoing rental assistance, again, is aligned with the eviction protections efforts that are there as well. And then just creating a general database of human resources that are available to all of our residents, so that no matter what the challenge may be it food, be it workforce, education, be it eviction protections, all of the social service safety net avenues that are available to many of our residents, we want to ensure that there is a consolidated avenue for them to be able to access that information in a clear-cut manner. Next slide. The final two are dealing with property tax default anticipation mechanisms. Again, this is something new as we continue to see not only the rental and eviction protections for those who may be in the rental market, but for many of our homeowners who may find themselves without the usual resources to be able to take care of those expenses. We will find that property tax default will likely increase when we look at those data and that number as well. So we're looking at, in anticipation of that becoming a challenge, of how we may be able to support many of our homeowners to ensure that they're able to keep their homes, certainly not only during COVID, but also post the epidemic as well. And we'll continue to keep under review our all-weather docking stations. Again, as we look at the short-term recommendations around food distribution, as well as our GIS mapping, we're looking at having those stations periodically throughout the county in order to be able to grab that data and have it in a much more succinct fashion, but also in a much more real-time fashion as well. So again, the work continues. I do want to applaud the work of all of the professionals that bring their efforts to the Human and Social Services effort. And with that, I yield back to you, Mr. Chairman.
Ms. Allen-Herring, thanks for that report. And I think just if you think about how our community needs to recover, just the number of recommendations around human and social services, speaks to the impact that COVID's been having on our community, and really appreciate the work of your subgroup. Now I wanted to turn to Dr. Wright, who heads up the Health Recovery Work Group. Dr. Wright.
Good afternoon, everyone. And I'd like to move quickly through our 7 approved recommendations. I would be remiss if I did not acknowledge the support that we've received, the strong support, since obviously so many of our members are very tied up in the response and now the vaccination effort. I want to acknowledge Linda Turner, of course, and Ryan Middleton and DCA Askew, who has helped us to steer this ship. So we've had 7 specific focus areas. I'll just review them very quickly here. Health operations. It's interesting. We've been at this so long that when we first framed these specific focus areas, it was preparing for the next wave. Well, guess what? We are in the next wave. Continuing response needs. Health department infrastructure. A great deal of our effort has focused on the health department. Equity, strengthening systems of care coordination, and then finally filling the gaps. Next slide, please. So I've mentioned a strong focus on health department throughout all of this effort, and recognizing that the health department is not going to be able to do its work unless it's properly resourced. So this first approved recommendation focuses on funding for the health department in order to not only respond to disasters and epidemics and such, but also to do the day-to-day work of public health in Prince George's County. Next is countywide testing. This was an activity that obviously was ongoing and needs to continue to be ongoing, and is an existing recommendation that is moving through the short-term phase, and quite honestly, I expect it to be part of our long-term conversation as well. Next slide, please. So when we talk about data, one of the things we realized in our deep dive around health department resources was the importance of up-to-date data systems, and data systems that are integrated and can talk to each other, talk across jurisdictions. That's been a challenge when we talk about an epidemic that does not ascribe to geopolitical boundaries. It's a regional phenomenon, and I want to commend the work of Dr. Dr. Carter's epidemiology team in producing the kind of data that at the health system level we can use to drive our efforts, and specifically the lead epidemiologist, Donna Perkins. We really appreciate what that team has been able to accomplish. However, we recognize that there are shortfalls in the data systems that the health department has at their avail. So this recommendation is focused on building and strengthening that data infrastructure. Next, we talk about the vaccine, and I'll later on in the agenda, we'll take a little bit of a deeper dive. This is where we are. The implementation of a countywide vaccine program. Can't talk about vaccines without talking about vaccine hesitancy. We are living this, and I'll talk about that in just a little bit. Next slide, please. So in terms of behavioral health, this recommendation seeks to standardize a recognized tool, a validated tool, the screening, brief intervention, and referral treatment SBIRT interventions to be used in hospital settings. And this is really critical because we've seen so much behavioral health comorbidity through the pandemic, and not all of it. Obviously, the overwhelming majority of it is in the ambulatory setting, and being able to have our folks trained and facile in the SBIRT intervention has really helped us to move folks through the system, and really facilitates not having to overburden our inpatient behavioral health capacity. Next slide talks about careers. I'm sorry, back up one. Yeah, the next recommendation. I want to just emphasize this one. It's not only creating recruitment strategies and hiring methods specifically around multilingual candidates, but we want to see the health department and public health become a career destination. We really need to attract young people to careers in public health, and for folks to be able to look at the health department as a place where they can build their professional identity. Next slide. Last one here focuses on what has already been mentioned, continuity of operations. The health department has been, as we all have, has been overwhelmed with response to the pandemic. However, there are other needs, and the health department needs to be able to respond to all emergencies and all public health urgencies, and the public health emergency preparedness program, an existing effort, just needs to recognize the need to bolster the health department's ability to manage all public health needs, including emergent needs like a pandemic. So that concludes my presentation, and I'll be back to you just a little bit later to talk about vaccines.
Dr. Wright, thank you, and thanks for the work of your group, which again is so critically important to us being able to move forward. You know, and I compliment all the groups for creatively looking at solutions, and also looking broadly. You know, for instance, you brought up the SBIRT need as people are coming in with comorbidities, and making sure that we're addressing that, not just the COVID impact. You know, you saw the same, Mr. McCarthy was talking about government operations, and the mental health for supervisors, and then things like, looking beyond just what we do to, multilingual, the need for more multilingual, I'll say representatives and people in the, in the healthcare sector and other places as well. So thank you for that. Again, if anyone has questions, please just put them in the chat box, and we'll be glad to call on you. And while folks are doing that, I just wanted to make a couple comments. One is to let you know that Dr. Dukes and I had the privilege of representing this task force before the Prince George's County Council on January 12th to walk through all the recommendations that we presented today here with them, and get their feedback and comments. And I think we've begun to pass those feedback and comments back. But I will tell you, they were very, very appreciative of the work that this task force is doing. Recognize that everyone here has other jobs and responsibilities, but to take this on with the energy and creativity, you did, very appreciative. And again, able to provide some feedback to us as well. And also prior to that, Dr. Dukes and I also met with a smaller group of other civic leaders throughout Prince George's County to provide them with an update primarily on the actions today, and also receive some feedback from them, which we're passing along. And again, many of the comments we've received, we were able to respond to in the moment, and a lot of them we were able to respond to say, yes, the task force and the members have considered that, and this is how they're considering that as well. So I'll just give it one more before we move on to Ms. O'Connell to give us a update on the public communication. Just give it one more moment here to see if there are any questions coming up. Okay, well, let's move on. And next, I wanted to get a brief update on public communication. Ms. O'Connell?
Sure, thank you. Thanks to you and to Dr. Dukes and all of the task force members for inviting us back today to give you a very brief overview of where we are and how things are moving. I'll say overall, I think that when this task force first started, we were on sort of the tell portion. We're doing this task force, the chairperson announced that, county executive announced it, but we're now definitely into show and tell as implementation is happening with some of the actions today, recommendations. So as we look towards releasing the Visions for Tomorrow, the short-term recommendations report, I just want to sort of flag a couple things that we've learned in our initial sort of work here. We did a couple things that just really were sort of less of interest to reporters, but super interesting to residents. And so we know that there are opportunities both with the with our community and county partners and reporters. So for example, Dr. Pines, Dr. Bro, and Dr. Goldson did a webinar with Congressman Brown. He does these kind of weekly formats, and to talk about the dual enrollment recommendation. Congressman Brown was able to do like a pretty significant amount of promotion for the task force coming on to his webinar. And it turned out they had a total of like 12,000 people engage with the webinar, watch some of the tape. So that was a terrific opportunity to promote the task force and the recommendations to the community. And so as we look forward to Visions for Tomorrow, we're gonna figure out what opportunities we can use with not just Congressman Brown, but some of the other county council members who have these standing Zoom meetings, these community forums, so that we can bring the work of the task force to them. I think another sort of work in action is that last week we taken the recommendation from Dr. Wright and the Health Committee to really address this vaccine hesitancy. The county executive invited Dr. Fauci to do a Zoom call to talk about vaccine hesitancy. And so that's something that will be the county executive's communications team and David Sloan. We're kind of figuring out the format of that, but it's something that we're going to start talking about next week, that the task force was part of that upcoming seminar, and that'll be February 8th, to mark your calendar. Zoom call, I should say. So with Visions for Tomorrow, just quickly, we want to take some of the sort of model what we did the first time when we released the first report, do a overall sit down with as many recovery group task force chairs and our co-chairs with reporters talking about this, all of the recommendations that came into Visions for Tomorrow. So as we get this report final and it's, sort of fluid, David and I will be working to find the best time to do this sit down with reporters, because really at this point, it's not just the recommendations that we have, but it's that it is this very dynamic, hardworking task force and process that is doing recommendations and implementation behind that. So we want to sort of wrap that into how we're telling the story of where the task force, how the task force is working right now. We're going to be sort of taking that sort of work also and thinking about opportunities to do a bigger sit down to talk through all of this work with like a Maryland Matters or a Kojo before he leaves the market in this spring, to try to see if we can get a segment talking about this sort of reimagination of government as expressed through the work of the task force. Then of course we'll do what we did last time. We're going to work with the project managers and directors and come up with a suite of sort of press and community ideas for each of your recommendations. So for example, I think that we had some fits and starts. as Tom Graham knows, and trying to get a story out there on some of the recommendations from the economic recovery team. I think now we've got a deeper, sort of richer story to tell. And so we're going to look for doing working with the county executives communications team to identify business reporters who are going to want to sort of dig in and think about and talk about this story about sort of improving the regulatory process in the county. To Dr. Pine's recommendations, the Parent Support Center, the online mentoring is really sort of, it's important now for families. And so we'll figure out ways that we can work to lift up and to make sure people know how hard we're trying to help families here, the task force, both today and tomorrow, and getting our kids through school. With Ms. Allen Herring's recommendations, we think this is an opportunity to actually sort of less press, but more community promotion to make sure residents really know about this expanded suite of services that the county is trying to provide its residents in this critical time. And so we'll probably look at some, possibly digital promotion for some of these. And, in the way that Ms. Herring, you talked about the geo-targeting of some of the resources. Think about how we can geo-target some of the digital promotion as well. So it's reaching the right people. And then, with health, I just think we're sort of always talking to Linda about where different opportunities where we can sort of help lift up the really immediacy work that that Dr. Wright and Dr. Askew are doing for the county. So, and one last one I'll just mention here is that the other interesting piece of this, where we are in this task force, is there was a lot of sort of crossover with mental health. And so we're going to think about what healthcare reporters are going to be interested in the way that the county is addressing mental health crises and the different ways that your subcommittee groups have made these recommendations. So we'll sort of we will be thinking of ways to use a couple of you to really lift up that mental health story. So David told me to be brief. Hopefully I was brief and fast, but happy to answer any questions.
Thank you, Sheila. And I'm going to jump in because I have the next section, which will just dovetail into this, and we'll be really quick because we want to get to Dr. Wright's vaccine champions presentation. And
David, I'm going to interrupt you for one moment, please, because we do have a question from Jim Eastep with regard to the report outs by the subcommittee chairs, and just want to make sure that he's able to ask his question. So Jim, if you'll unmute and just ask your question, please, and then we'll come back to you, David.
Thank you, Dr. Dukes. That's what I get for following instructions. I had a question for Jared McCarthy. During your presentation, you had talked about you had some great recommendations, by the way, as a former department head. And the one I'm focusing on is on employee evaluations, the performance evaluations. I think if you're able to make changes in that, it'll probably be the single greatest contribution anybody's ever made to the employees of the county. But my question is, what has been the labor response to that? Or have you talked with them yet? And in general, what has been their response to what we're doing here?
So thank you for the question. And quite frankly, I don't think we're at that stage yet where we have engaged labor. We're in the planning stage at the moment. Obviously, that's always an issue, but one of the good things about how the contracts are mostly set up is if it is a county-wide change that applies to all employees, it's not a matter necessarily subject to bargaining. So, but we all know that there's obviously, you can't just run roughshod over your unions. You have to engage them. You have to speak with them. You have to roll out your plan. So that is part of where this goes. And one of the biggest things we think labor will agree with is these are not useful for employees. So from that perspective, we will certainly engage labor. It is something that is on our radar, and we are aware that that is always not necessarily a hurdle, but something that needs to be addressed.
Great. It had just been an issue in the past when there was an attempt to make any changes of that type. Thank you very much.
Not a problem, sir.
Thank you. Thank you for that. Both Jim, for reminding us that you had the question, and then, for the response. So David, we'll move on to you as you give us an overview of the implementation process of previous recommendations that were approved.
Yes, ma'am. And just to make it kind of connect with what Sheila was talking through, we are in a place where our communications needs to achieve a couple of different goals over the next couple of weeks. One obviously is releasing the report on your visions for tomorrow and communicating out, the package of approved recommendations. For that to work, Dr. Dukes knows and Dave Velasquez knows that they have been subject to a very fluid scheduling plan to have the final conversations on those final pieces, which we really hope will be done early next week, and which will allow us to start the press conversation and engagement, hopefully by the end of the week or into the next week. But we'll be able to do that, pointing to, I think, a really healthy package of approved recommendations, and also representing where we are on implementation. Everyone received, hopefully, and has circulated amongst your committees the task force actions today, quick recommendations, implementation summary report, which went out right before Christmas. Of our 38 approved recommendations in that first category, 7 are already completed, 21 are in progress, and 10 have yet to be initiated. What we're doing right now is we're going back to check in on those 10 and hopefully providing another progress report in the month of February. Okay. And so please stay tuned for requests for scheduling on the media engagement. And we thank you all in advance for your patience and grace in this very fluid time. Dr. Dukes.
Thank you. That was much faster than even I thought it would be, David. But I do want to remind everyone, both the members of the task force, our support across the county agencies, and our listening and viewing public, that we will actually post all of this on the website at www.pathforward.com, so that if there are any questions that come in or comments, then we can take those at pathforward@co.pg.md.us. So thank you for that. And at this time, we're going to hear from Dr. Wright again, who is going to provide us with an update on vaccine information and the needs for champions. So Dr. Wright, we'll turn it back over to you.
Thank you, Dr. Dukes, and I thank you for the opportunity to share this information. As I mentioned during the earlier presentation, this is where we are. This is where we're living. And I just want to take a few minutes here to share with you from the perspective of a healthcare delivery system, some of the challenges that we're facing. Next slide, please. So I want to talk a little, this is an ever-changing situation with the surge. So I'll just speak a little bit about where we are and how that messaging might actually facilitate the hesitancy campaign. I'll talk about the pathway to immunity, the case for vaccination, the data, the scientific reason why we must do this in order to recover. And then again, I'll wrap up talking about the need for champions. Next slide, please. So even though this slide is a little bit dated, a week dated, the point that I want to make here is that we have eclipsed a very critical milestone, and one that allows people to wrap their minds around the depth and intensity of the pandemic. If you put 1,000 people in a stadium or 1,000 people in a gymnasium, one of them will have died from COVID. That's across the country, which, by the way, has now eclipsed 400,000. So that ratio is well greater than 1 per 1,000. And in the state of Maryland, when I last looked earlier today, was at 68,000. Again, the idea that for the public, if you think about 1,000 people, or you think about the other question that I ask people is to think about how many degrees of separation any one of us has from someone who has been impacted by the pandemic. Next slide, please. So this is what our healthcare system, the Capital Region Health, has looked like over the past 8 months. You see, if you look at the left-hand side of this slide, that the blue bars represent the percentage of our census that was COVID. So you see there in early May, we peaked, and now look over to the far right where we are in January. We are at that same level of intensity in terms of hospitalizations. And this is not unique to Capital Region Health. This is what all health systems are experiencing across the county and across the state. You talk about continuity of operations, as Mr. McCarthy talked about. We are having to manage this in the face of continued trauma care, of continued chronic illness, and a lot of delayed care that has occurred earlier in the pandemic, we're now beginning to see the consequences of. And my board member Jim Eastep knows this well, as we report this information out to him and the other board members, trying to maintain that bilateral operation while dealing with the pandemic. Next slide, please. And then lastly, what's ahead? So this is a projection of the resource needs based on what we expect. The top line, the purple line, represents beds. And we've done a lot better this time around with preparing for the surge in terms of bed capacity. The ICU beds are represented there in green, and then finally ventilators at the bottom. What I will say is, and I'm sure my colleagues, healthcare leader colleagues, Christine Ray and others will attest that the challenge for the healthcare systems this time around is not as much equipment, PPE, and beds, it's staffing. It is staffing. And being able to be responsive to this surge with the appropriate number of team members is a challenge for all of our health systems. So let's pivot now to, next slide, Linda. Let's pivot now to really focus on what we're facing in the pathway to immunity and making the case for vaccination. Next slide. So you all have heard about a number of scientific terms relative to the vaccine, S protein. I'm sure you've been asked, as I have many times, Doc, can I get the virus from the vaccine? Let me just take a moment to level set about the science of how the vaccine is developed. So here's a picture of the coronavirus itself that was genetically mapped last December. So the reason that we were able to move quickly to develop the vaccine is because early on in the pandemic, the genetic code that defines this virus was defined. And as such, there was recognition that this protein that sits on the surface of the virus, this S protein, could be reproduced and be part of the vaccine that actually is injected into our bodies to generate that immune response that is not dependent on any part of the virus. This S protein and the messenger RNA mechanism to reproduce it is what is the scientific hub of the vaccine. So when you are administered a COVID-19 vaccine, there is no part of the actual virus that is injected. Your immune system responds to basically these instructions that make it feel like the S protein is present, and then your body does the rest of the work, such that the next time that the COVID-19 enters with its S protein on its surface, your body responds, and the antibodies that you've developed destroy the vaccine before it can make you sick. So that is the scientific explanation to the frequently asked question about, can I get COVID from this virus? And this is unique to this vaccine, by the way. Previous technology around vaccine development does require a small live attenuated version of virus to be injected in order to stimulate your immune system. This is different. This is important to really level set with the public, that it is scientifically impossible for the vaccine to generate COVID-19. Next slide, please. So that said, We've heard a lot about variants. Vaccines mutate all the time. The most recent variant that's been identified, first in the UK a few weeks back, now here in the United States, and in fact here in Maryland, is expected to become the dominant strain in the United States within 2 months. And why is that? It's because that this variant is much more efficiently transmitted. So once it gets into the host, it is much more efficiently transmitted to others. So the infectivity rate, which is something that that folks on this call may be following here for the county and across the state, would rise as this variant comes into community spread. That rate of infectivity will become much more rapid. So that's what this variant is all about. And again, thus far, the vaccines, certainly the Pfizer company has reported that their vaccine is effective against all strains and all variants so far. Next slide, please. Okay, so the other question that I get frequently is, well, Doc, what's the alternative? And it's amazing to me. We're in a health system where 60% of our employees reside in Prince George's County. So these are folks who have been taking care of the sickest of the sick. And so when I get the question, it really has me scratching my head a little bit, because it seems to imply a bit of a disconnect or a dissonance, if you will. So the reality is, I just wanted to put it down on paper here. In the month of December, when there were 2 million vaccines administered and 21 severe reactions, no deaths. And if you do that math, that's a probability of 1 in a million severe reaction. 77 million people lost their lives during that same period. And we're beginning to recognize the post-infectious complications of COVID as we move along. There was a young man who is a member of the University of the Florida State University basketball team, who collapsed on the court. And the reason he collapsed was because he developed a myocarditis, which is a autoimmune inflammation of his heart. And his heart was not pumping efficiently, and he went down. He has recovered, but this is now recognized as part of post-infectious autoimmune complications that we're beginning to see with COVID. And fully 20% of patients have not returned to their baseline after 3 months. These folks are known as long haulers. So again, as champions, this is the kind of information we need to have at our fingertips when people ask that question, well, what is the alternative? Well, the alternative is pretty clear. We've been living in the alternative for a year. Next slide, please. So how do we get to recovery, which is what our task force is all about? We can finally authentically talk about herd immunity. Herd immunity was thrown out there as a term inappropriately, prematurely, for political reasons or whatever, way too early in the pandemic. We are not at a place where we can talk about herd immunity as we vaccinate individuals. So if we just follow this image along the picture at the bottom of the slide here, when we have few people vaccinated, one person infected in red can infect a whole bunch of other people, right? There is no level of protection in the community to prevent the virus from spreading, community spread. However, as we vaccinate more and more individuals, that infected individual who is not vaccinated is able to spread to fewer people. And then to the far right there, where we need to get to is a place where there are far more people vaccinated than who are susceptible to infection. And that is really, it's a pretty simple concept, herd immunity. And we really honestly need to get to a place where we have vaccinated 65 to 70% of our population to look like that image on the far right there. Next slide. So what else does recovery look like? Well, there is speculation that if we do this right, in other words, achieve the kind of widespread vaccination that we need to, that COVID-19 will become endemic. So no longer pandemic, no longer epidemic, but will be at a constant level, baseline level in the population. And again, this was reported in Science last week, and so recovery would look like endemic. So it may, at this point, we don't know whether the COVID-19 vaccine would be something we need to do annually. This is continuing to be evaluated. However, we do know that if enough people are vaccinated and develop immunity, we can tamp this thing down so that it certainly is not at a place where we are now, and potentially becomes endemic. Next slide, please. So what do we need to do to combat hesitancy? As I mentioned, 60% of our workforce lives in Prince George's County. And I will share with you that when we first rolled out the vaccine, great deal of enthusiasm. And for the first 3 weeks, we had no vacancies in terms of the appointment slots to get the vaccine. Well, that enthusiasm has waned. And we're now, next slide, please. We're now really embarking on an internal campaign. And I just want to share this one real quick, where we are. This is the national song sheet, if you will, around which the prioritization is being rolled out. Right now, we are straddling 1B and 1C, where individuals basically 65 and older are eligible to receive the vaccine, educators and different categories of workers. This is where we are now, and rapidly moving to get to where we need to be, which is phase 3 down there at the bottom, general population, everyone. Next slide, Linda. So as I mentioned, we are really at a place where we have hit hesitancy big time. So we are embarking on an internal campaign that where we've identified internal champions. Our CEO, Nat Richardson, down there at the bottom left, our minister, our local minister, Minister Tracy, who is works for EVS and is passionate about our workforce getting vaccinated. My colleague, Dr. Trudy Hall. And you see here, we're socializing this button. I'm wearing it right now on my ID badge, where we want there to be, we're not trying to shame anybody. However, we want there to be an enthusiasm around contributing to ending COVID. So we've been providing these buttons to those folks who have been vaccinated. So in terms of lessons learned that would apply to our work here in the task force, next slide. And this was undertaken by the nurses on the unit. And again, this is not mandatory, by the way. The vaccine is not mandatory, to make it clear. But they took it upon themselves to begin to post on their bulletin board, on their unit, which of their colleagues has been vaccinated. And this is, again, a tool, a mechanism by which we're trying to generate enthusiasm. Next slide. But what's real? I have been covering our vaccine clinic for several weeks now, and I've been talking to people about their hesitancy. And this history of transgressions is something that we have to acknowledge, we have to address, we cannot gloss it over. And it's not just a Tuskegee experiment. That's the one that perhaps people are most familiar with, where therapy was withheld, by the way. There is a misnomer or misperception that those men were injected with syphilis. In fact, they were denied penicillin. There's also the story of the immortal cells of Henry Lax, which is also in our market, involving a neighboring health institution. But these transgressions have been going on forever. There is the father of modern gynecology, J. Marion Sims, who operated without anesthesia on enslaved women. And then the story of Vivian Thomas, chronicled in the film Something the Lord Made, who was excluded of any attribution of the remarkable work that he did to develop the Blalock-Taussig shunt to correct a major congenital heart disease. So these are some of the stories that folks may or may not be aware of, but we have to acknowledge it. We cannot just gloss that over. And I have shared with my colleagues in our health system that you must have cultural humility when listening to people. You cannot and so this requires, in my view, and what I've been sharing with our colleagues, the need for peer-to-peer private conversation. I've done a ton of what do you call them, Zooms and calls. But what I have found to be most effective are these peer-to-peer private conversations. And so I just wanted to share, this contributes to folks thinking, and we have to respect where people are coming from, their lived experience, and how that contributes to hesitancy. Next slide. So what do we need to do? We need to develop champions, and indulge me a minute here as I describe what community influencers look like and where I think the task force can be extremely helpful. So we need community influence to change community norms and attitudes about moving from contemplating the possibility of being vaccinated to being vaccinated. This is done through authentic engagement with influencers and those who trust them as messengers of accurate and transparent information. So what are the characteristics of an influencer? Linda, next slide. So an influencer, popular in the community, someone who people listen to and receive information from, are able to leverage their large networks and followers via social media, etc., are willing to share accurate information and their personal experiences. And then finally, are willing to wear conversation starters, whether it's a button, like I just shared with you, a t-shirt. So what does a community influencer look like? Well, let me show you. Next slide, please. So that's a community influencer. So our intrepid co-chair, so she's got all the attributes, right? She's got two versions of her mask, right? She's got two versions of the mask. Yeah, you know, she's and I'm not violating any, no HIPAA violations here. Dr. Dukes and I talked about leveraging her image here. It was interesting. I'm gonna tell on my co-chair here. Our vaccinator was so fast that Dr. Dukes in the bottom image was, is it done? I was just totally surprised that the thing was done. But I share this, and I also want to share, this is my last slide, the tagline that the county executive and the comms team have been promoting: proud to be protected in Prince George's County. We need to socialize that kind of message. We have this step and repeat sign in the hallway outside of our clinic where I've liberally been taking pictures. And again, I'm not going to violate any HIPAA rules here, but I know that there are people on this call, I'm not going to call them out right now, who meet that criteria and can serve as champions. And I really want to encourage our task force. The members of this task force certainly can check many of those boxes about being effective champions and really get this hesitancy campaign moving, because this is the only way to recover. That we must get to a place where we have protected our community so that all of the elements of our task force are able, all of our recommendations are able to be realized. So that's what I wanted to share. I'm happy to answer any questions. Turn it back over to Mr. Velasquez, Dr. Dukes.
Yes, thank you so much, Dr. Wright. And it was certainly an honor for me to take the vaccine and recognize that I have the opportunity to share that with those who are in my network. I will tell you that the vaccinator did ask me to, she said, okay, we're going to do this, as I was talking to someone else. And she said 1, 2, 3, which I thought was giving me an opportunity to prepare for the sting. And what she did at that point is she actually slapped the Band-Aid on my arm. she had already done the shot, and I had no clue that it, so it was very easy to do. And I've had 0 reactions, you know, to this point, and just was happy to do it and to say, how can we use our voices to support moving away from vaccine hesitancy in our community to taking the vaccine. There are a couple of questions. So if I could ask April, if you would unmute yourself, April Richardson, and ask your question of Dr. Wright.
Sure. Hi, Dr. Wright. Thank you for the information. It was helpful, especially the explanation in terms of how the vaccine works. There's so much misinformation out there. One thing that I am hearing is that when people are not showing up for their appointments, that the vaccine may or may not be going to waste. Has that been your experience? And if not, what is the protocol for if a person does not show up for their appointment to receive their vaccination?
Well, thank you for that question. It hasn't been our experience because, of course, we're administering vaccines inside of a healthcare institution. So we have had 0 waste. There are plenty of people around. But first of all, we have not really had that much in the way of folks not showing up. But you're absolutely right. Because of the need, we happen to have an ultra freezer here. So storage is not an issue. What you're referring to are vaccination locations where it is time sensitive to administer the vaccine and administer all the vaccine that you have on hand. So I don't know if I would call it a protocol, but the goal is to administer all the vaccine you have on hand in a given vaccination session. You don't want to walk away with extra vaccine at the end of that session. Yes, and certainly there have been reports of extra doses available and folks literally calling family members and such. You know, my point is this: we are this close to being in phase 3 where everybody is vaccinated. So look, you know, we don't turn anyone away. Where you have to schedule, by the way, let me be clear. You have to schedule. This is not a walk-in free-for-all, but at the same time, if someone is in front of us, they need to be vaccinated, we vaccinate them. So I guess my answer to your question is the protocol is we do not waste vaccine. We find an arms connection. Yeah.
And Dr. Wright, just to follow up, how do you prove if a person meets a category? So for example, I think it's phase 2, maybe where it's food workers. Who's vetting to make sure that people are not cheating?
You know, look, it's an honor system, April. We can't hold people to, you know, what we are emphasizing though, and let me say this for this group, we are prioritizing obviously Prince George's County residents. And so we do ask people when they schedule their appointment to be prepared as part of the registration process when they arrive to have an ID available. But April, we are beyond, and as I said, at this point when we are hurdling towards phase 3 where we need to vaccinate everybody, you know, we are holding people to that honor system. There's no way to really quote unquote prove categories, April.
So, and if I may, I think that Tom Graham has a question, yes, followed by Rosie Allen Herring, followed by Daryl Pines, and then Peter Shapiro, in that order.
Yeah, yes, Tom, I think I saw your question in the box.
Yeah, so I mean, I think you've been addressing it. I mean, some of the things, you know, to be honest, you know, I have a lot of discussions, you know, in my network about this, and I've had it, you know, within my family. And so I think there's been a shift from, especially in African-American communities, right? There's been a shift from a hesitancy to move forward to now seeing how the pandemic has continued to kind of grow, the death toll at 400,000. I mean, it's getting scary. So I think now people are more open to it. And some of my friends who told me they were never going to do it, apparently they've already been vaccinated. So I thought that was interesting. But some of the and I've gone ahead and I pre-registered. I think I'm phase C, so I'm waiting my turn, whatever that process is. But so one of the questions has come up related to the 2 vaccines, and some people say, I don't want to, this one's not any good. I don't want to take this one. I'm only going to take this one. It becomes available. I mean, how do you, if you want us to, be champions, be messengers, and I also think we'll probably need a little bit more information to have an intelligent conversation, or maybe, maybe we set something up in a broader group and then have someone really smart like you come on and really explain it to people. But, these are the, the questions that are out there. Difference between the vaccines is a big deal.
Yeah.
To me. Now there's another one coming down the road.
Yep. Yep. And Tom, I'd be happy to, first of all, and let me just really quickly, the difference between Pfizer and Moderna is really a function of storage. There is, from the standpoint of efficacy, and from the standpoint of side effects, no discernible difference. And that's one of the frequently asked questions as well. The principal difference in the timing is Pfizer is a 21-day between dose 1 and dose 2. Moderna is 28 days between dose 1 and dose 2. The difference in the manufacturing is one that's our problem. We need an ultra freezer for Pfizer. Moderna doesn't require the same intensity of cold to store it. But you're absolutely right. Johnson & Johnson is on the verge next week, I believe, of submitting their emergency use authorization. And that brings a whole nother dynamic onto the field, because that's a 1-dose vaccine. So yeah, Tom, I couldn't agree with you more. In order to really activate this champion idea, we have to be very crystal clear on all these questions.
Right.
I threw in that slide though, because the one thing that I found personally that can't be glossed over is people's hesitancy based on their personal experiences and mistrust of the healthcare system.
Right.
So in the interest of time, we are at 3:33. We're going to answer the questions that are here, but if you all don't mind, I'll ask. Rosie Allen Herring, did Dr. Wright answer your question about the differences between the vaccines?
He did indeed, and I will talk with him offline about the champion work that United Way is doing to get to much of that mistrust that he's mentioned. It's very real.
Thank you. And Dr. Pines, I think your question is about shots in the arm, and so I'm going to let you ask it just so I don't misinterpret it.
So it's very simple. First of all, thank you, Dr. Dukes, for your leadership and for the communication campaign, number one. Number two, Dr. Wright, that was an excellent presentation. I'm very impressed. You made things so simple, so grateful for the presentation. A simple question is, how many shots in arms do you do there at your facility on a daily basis?
Yeah, so again, just a reminder, we're not the health department. We're still we're still trying to take care of COVID patients. So we've got 5 lanes, meaning vaccination lanes, that allows us to get 240 shots in arms a day. And so that's our capacity. I will tell you though, since the governor's mandate to open up to 1B last Friday or Thursday, the last 2 days, we have been beyond capacity, 250 and on Tuesday and 255 yesterday. So the enthusiasm of the community, largely the seniors, remember, we're still in 75 and up, 65 and up, has been tremendous. That the last 2 days have really spoken to what I think Tom was talking about.
And the next question from Peter Shapiro is whether or not agencies can get a copy of the slide deck.
The deck is in the hands of the task force, so you all are welcome to circulate.
I mean, if I could just take a sec, what you said, Dr. Wright, and the way you said it with your voice and the slide deck, I think, many of us would agree was incredibly powerful. And so I wouldn't let the perfect be the enemy of the good. There's a part of me that just wants to take what you said and that deck and get it out to my team. We've got a bunch of customer facing employees. We have a fair degree of vaccine hesitancy. Something like this, I know, is going to turn it around immediately.
Yeah, whatever we need to do, Peter, I'm more than happy to participate. Obviously, follow the lead of the task force here. This couldn't be, and I don't mean to really have pride of ownership around any of our recovery efforts, but unless we get this part right, the other recovery components will suffer.
And I do know that there is at least one last question around considering hosting a town hall meeting and presenting the information that you just shared with us. And what I will say is that certainly Dr. Wright, Dr. Askew, Dr. Carter will have some offline conversations about how we can continue through all of the mediums that are available to us to both inform, communicate, and educate our residents in Prince George's County. So Loopy, if I could say to you, take that as a yes, and we'll figure it all out and make sure that we're communicating and asking you all to not just be champions and influencers, but be part of the communication process as well. The other thing that we'll do offline and share it with all of the members of the task force is to give you some idea about how you can be champions and what does that mean for each of you as you're making your own personal decision around that. And that I hope that as community members and friends and neighbors, all of us who are committed to Prince George's County post-COVID, that you will do whatever it is that you can. You may not be able to do everything within the context of the definition of an influencer or a champion, but you can do one or two things. I hope that that's what you'll walk away with. We do want to thank you for allowing us to extend the call. I think that Dr. Wright's information was so valuable. And if you will allow me a point of personal privilege, it is so refreshing to hear it from a scientist, someone who is well aware of what happens and how we need to move through this. So thank you, Dr. Wright, for your commitment beyond just this task force, but to the health needs of the residents of our community and our region. So what I will ask you all is to allow me to adjourn the meeting, but thank you for your continuing support. And then you will get more information from us about the next upcoming meeting. I know that the chairs of the subcommittees will be working with you on the long-term recommendations. We'll hear from Ms. O'Connell around all of the potential media possibilities, and we'll be asking the chairs of the subcommittees as well as some of the members to help us out with that as we continue to communicate to the public. Thank you all so very much. Enjoy the rest of your day. Look to hear from us, and we remember, we not only have your email addresses, we have your phone numbers if we need to call you.
All right.
Miriam, you're on mute. Is there something you want to say?
Yes, the February 10th at 5:00 p.m. is the county influencers call.
Okay, February 10th at 5 p.m. and we'll make sure to get that information to everyone. Take care.
All right. Bye-bye.
Bye-bye.